Okay, this is lesson number 19, the circulatory system and cardiac emergencies, okay? A heart attack occurs when blood vessels supplying the heart become blocked and fail to provide the heart enough blood and oxygen necessary to function properly. The condition which the heart stops functioning is known as cardiac arrest. It can sometimes result from a heart attack, but cardiac arrest can also be caused by sudden, irregular electrical activity of the heart, as well as many other issues. To provide care for a patient in cardiac arrest, you need to know how to perform cardiopulmonary resuscitation, CPR, and use an automated external defibrillator, AED. Okay, we are going to discuss a scenario here in which you are the emergency medical responder. This is something that we discuss in person, so just pay attention here to the scenario. You are called to the home of a 50-year-old man whose wife called 911 because he was complaining of severe pressure in his chest and pain that was radiating to his shoulder. The patient is now perspiring and breathing rapidly and appears very anxious. He states, "I feel like I can't catch my breath. I still feel the pressure, but it has gotten a little bit better." Okay, so here we have a scenario, and now we will discuss in person when we see each other. All right. Okay, we have anatomy and physiology, okay? So here you see we have the heart structures, blood flow through the heart, electrical impulse condition, and perfusion, okay? The heart is a muscular organ which functions like a pump, about the size of a patient's fist. It lies between the lungs and the middle of the chest, behind the lower half of the sternum, breastbone. The heart is protected by the ribs and sternum in front and by the spine and back. It has 4 chambers and is separated into right and left halves. The right side of the heart has 2 chambers known as the right atrium, which receives oxygen-depleted blood from the veins of the body, and the right ventricle, which pumps the oxygen-depleted blood to the lungs where waste products are removed and oxygen is absorbed. All right. Now we have, the physiology, okay? An electrical system in the heart triggers the contraction or pumping action of the heart muscle. In a healthy heart, an electrical impulse comes from a point near the top of the heart called the sinustral. The impulse travels through the atria, the upper chambers of the heart, down to AV node, near the bottom of the right atrium. Okay. Pathophysiology. Cardiovascular disease is the #1 killer in the United States. The 2 most common conditions caused by cardiovascular disease are coronary heart disease and stroke. Okay. Cardiovascular disease is an abnormal condition that affects the heart and blood vessels. An estimated 90 million Americans suffer from some form of the disease. It remains the #1 killer in the United States and a major cause of disability. The most common conditions caused by cardiovascular disease includes coronary heart disease, also known as coronary artery disease, and stroke. All right, coronary heart disease. Coronary heart disease occurs when the arteries that supply blood to the heart become hardened and narrow due to plaque buildup on the inner artery walls. Possible results include acute myocardial ischemia, acute coronary syndrome, ACS, myocardial infarction, MI. All right. So now we have other cardiac problems. Angina pectoris, arrhythmias, congestive heart failure, hypertension, and diabetes. Okay. So angina. Angina pectoris develops when the heart needs more oxygen than it gets because the arteries leading to it are too narrow. Angina pectoris is normally a transient condition when a person with angina exercises, gets excited, or is emotionally upset. The heart might not get enough oxygen. This lack of oxygen can cause chest discomfort or pain. People with angina usually have medicine that they can take to stop the pain. Stopping physical activity or easing the distress and taking the medicine usually end the discomfort or pain. Next is arrhythmias. Arrhythmias are electrical disturbances in the regular rhythmic beating of the heart. Some people have heart arrhythmias that do not cause problems, and others, they can indicate a more serious problem that leads to heart disease, stroke, or sudden cardiac death. So next is congestive heart failure, also called heart failure. Congestive heart failure is a chronic condition in which the heart no longer pumps blood effectively throughout the body. This may cause high blood pressure and a buildup of fluid throughout the body, resulting in difficulty breathing and weight gain. Fluid buildup and swelling usually occur in the face, hands, legs, ankles, and feet. Hypertension, also known as high blood pressure. Hypertension is one of the main risk factors for heart attack and stroke. A patient is considered to have hypertension when blood pressure is higher than 140/90 mmHg. The causes of hypertension are not clear. However, certain medications, sodium intake, and stress can contribute to a rise in blood pressure. Secondary hypertension is caused by underlying conditions such as a kidney abnormality or tumor in the adrenal gland. Last here we have diabetes. Diabetes can affect the nerves. Therefore, people with diabetes may not experience the classic heart attack sign of chest pain and may suffer a silent heart attack. People who experience silent heart attacks may have no warning signs, or they may have very mild signs. When this occurs, the diagnosis of a heart attack may have to be confirmed by special tests. Okay, here we have signs and symptoms of a heart attack. Persistent chest discomfort, pressure or pain. Chest discomfort or pain that is severe, lasts more than a few minutes, goes away and comes back, or persists with rest. Pain that comes and goes, such as angina pectoris. Difficulty breathing. Other signs, pallor, sweating, dizziness, or nauseous. Women are more likely to experience shortness of breath, nausea or vomiting, stomach, back or jaw pain, or unexplained failure, fatigue, or malaise. Care for cardiac emergencies, okay? So you want to act immediately and summon more advanced medical personnel. Have the patient stop any activity and rest. Loosen tight or uncomfortable clothing. Monitor the patient until more advanced medical personnel take over. Comfort the patient. provide supplemental oxygen based on local protocols, give aspirin if medically appropriate and permitted by local protocols, assist the patient with any prescribed medication, prepare to perform CPR and use an AED. All right, here we have another activity. Upon arriving at the home of a patient who is sitting on the ground near her vegetable garden, you are approached by the patient's husband, who says that he called 911 because she started complaining of shortness of breath. We were working out here in the garden for a couple hours, trying to get it ready for planting, when all of a sudden she got really nauseated and started to feel really tired. Then she said she felt this sudden sharp pain in her chest and had trouble catching her breath. Okay, so just think about what you will do in that situation, okay? And we will discuss this in person. So now we're going to look at the adult cardiac chain of survival, okay? So the first step is recognition of a cardiac emergency and activation of the emergency response system, okay? So the next is early CPR, okay? The longer you wait, the more things can get worse. Early defibrillation, advanced life support, and integrated post-cardiac care. One consistent thing you're noticing is early CPR, early defibrillation, okay? Sometimes acting 1 or 2 minutes late can be the difference in saving someone's life or not. So we want to be well trained and prompt when addressing these type of issues. Okay, now we have the pediatric cardiac chain of survival, okay? So the prevention of arrest, okay? Prevention is always key. We'd rather prevent something from happening than having to deal with it in its worst state. Early high quality CPR. Here we go again, early. Rapid activation of the EMS system or response system. Okay, so you don't want to wait too long to summon more advanced emergency medical care for someone. Pediatric advanced life support, integrated post-cardiac arrest care, okay? That is a pediatric cardiac chain of survival. Okay, here we have another scenario in which you are the emergency medical responder. You suspect that the 50-year-old man with severe chest pressure is having a heart attack, and you call for more advanced medical personnel, okay? Kind of short on this one. Doesn't give a lot of details. It just says that you suspect that a 50-year-old man with severe chest pressure is having a heart attack, and you call, and that's it. So we'll discuss this in person. Okay, so these are the steps you take when trying to prevent coronary heart disease, right? We already identified that prevention is the most important, okay? Coronary heart disease develops gradually, okay? So this is not something that develops instantly. A patient can't always feel this coming on. I'll say a person, right? Years of bad eating habits, years of excessive, being excessively overweight, these type of things can cause that buildup. The risk factors increase a person's chance of developing coronary heart disease. Risk factors that cannot be changed include age, right? We can't change our age, that's ongoing. Gender, it says cannot be changed, okay? Ethnicity, and family history, okay? So these are things that cannot be changed, and some of this can be hereditary. So here's prevention, coronary heart disease, okay? Risk factors that can be changed. So these are things that you can do something about. Smoking, Okay, you can do something about that. Uncontrolled high blood cholesterol. Okay, uncontrolled high blood pressure, uncontrolled diabetes, lack of regular exercise. Okay, so these are things that we can do to prevent coronary heart disease, and that concludes lesson 19.